This conference will now be recorded.
Welcome to our webinar on the state of the network. I'm Jonathan Siegel, the chair of the Medical Review Committee, and it's my pleasure to share the results of the projects that you all have worked on over the past year. We'll review some of the successes as well as the challenges that we've had over this past year. During the presentation, I'll take just a minute to review some of the characteristics of Network 11, and then we'll describe our major quality improvement projects that we completed in 2019. We'll finish up with an overview of the projects that we're currently working on for 2020. As of November in 2019, the Midwest Kidney Network now serves over 51,000 patients with kidney failure. That's a 2.5% increase from last year. You can see below the breakout with over 29,000 patients who are on dialysis and over 21,000 patients with a kidney transplant. Our proportion of home dialysis patients is fairly similar to last year at just under 3,900. And here you can see the breakout of patients and facilities by state. We see the majority of our patients and dialysis facilities in the network are in the state of Michigan, with about an equal number of patients and facilities split between Minnesota and Wisconsin. The number of facilities in the network is actually down by a few compared to last year. In this slide, we see the distribution of provider types at the end of 2019. DaVita has the largest number of clinics at 210, followed by Fresenius at 167. Just over a quarter of our facilities are either in a small regional chain or are independent, which makes us somewhat unique amongst the other renal networks, although we see that this number is slowly declining compared to the prior year. I'd like to review our quality improvement projects that we completed in 2019. We'll review results from our bloodstream infection project, which included both reduction in long-term catheter use, as well as helping facilities participate in health information exchanges. We'll review our projects to increase both the number of patients that are waitlisted for kidney transplant, as well as the patients that began training with home dialysis modalities. And lastly, I'll discuss our vocational rehab project, which was new this year, as well as our efforts to engage our patients and families throughout this project. Of our 535 facilities, almost 90% participated in at least one of our quality improvement projects last year. While our biggest project was focused on reduction in bloodstream infections and reducing long-term catheter use, we had a significant number of facilities participate in both our transplant and home dialysis projects. Our vocational rehab project was on a smaller scale with 53 facilities that participated. Now let's review some of the results. Starting with our bloodstream infection project, our goal was to reduce infections by 20% from the baseline rate for those facilities that had high rates and were selected to participate. We had a total of 237 facilities participate in this project, although there was a particular focus on the 103 facilities that had the highest rates of bloodstream infection that made up about 40% of the cohort. Similar to past years, we used multiple interventions for this project, including webinars, monthly coaching calls, and shared tools to help patients and providers better care for their vascular access. We shared best practices developed by one of our facilities to help with early identification of bloodstream infections. Our Healthcare Acquired Infection Learning Action Network, or HILAN, brings a multidisciplinary team to aid in these efforts. At the bottom, you can see that this has been a successful project. Our baseline was 1.4 infections per 100 patient months, and by the end of the intervention, the rate was down to 0.86 infections per 100 patient months, a 39% improvement. Here you can see how the project cohort did relative to the rest of the network facilities. The blue bars are the baseline period from January to June of 2018, and you'll notice that the infection rate in the project cohort is almost twice that of the rest of the network. During the intervention period from January to June of 2019, shown in the green bars, we see that the project cohort had a decrease in infections from 1.01 per 100 patient months down to 0.72 per 100 patient months. Over the same period of time, we see that the bloodstream infection rate in the network remained relatively stable at 0.57. Overall, we've made great strides towards lowering our bloodstream infection rates, and I'd like to encourage everyone to keep up the great work. As part of this project, we also had a goal of reducing our long-term catheter rate by 2%. We focused on 61 facilities that had long-term catheter rates of above 15%, and our interventions included off-site record reviews, educational webinars, and tools to help dialysis facilities better track the vascular access pathway from catheter use to surgical access. Among these facilities that participated, the baseline rate of long-term catheter use was 19.7%, and with the intervention, we were able to reduce that to just under 17%, a 2.8% improvement. Last year, you may recall that we were just under the 2% improvement in long-term reduction, so we really appreciate everyone's efforts to double down and make sure that we met our goal this year. In this slide, you can see the month-over-month change in long-term catheter rates for the cohort, starting at 19.7 in the baseline period and dropping down into the 14 to 16% range over the course of the year. The last component of the bloodstream infection project was to help 20% of the facilities and the cohort join a health information exchange. For the last several years, there have been ongoing concerns that dialysis facilities are not always able to capture infectious episodes that occur in the hospital setting. By joining a health information exchange, dialysis facilities have improved access to medical records outside the dialysis facility. We did meet our goal for this portion of the project and helped 77 facilities join a health information exchange so they could better identify, report, and treat bloodstream infections. Turning to our home dialysis project, our goal was to have 857 patients start home dialysis training. We had 169 facilities participate in this cohort, and our efforts focused on helping dialysis facilities establish good working relationships with home dialysis programs, patient and staff education with webinars and on-demand presentations, and tracking tools to help facilities achieve their goals. Remember that last year we fell short of our goals, but with your sustained efforts, we were able to meet our target in 2019. So again, strong work to all those who participated. And in this slide, you can see where Network 11, shown in the yellow bar, compares with the other networks in the country in terms of percent of goal met for the home dialysis project. And so we were pretty much right in the middle of the country in terms of the other networks. Turning to our transplant waitlist project, we had a goal of adding 430 patients to the waitlist. We had 169 facilities participate and used a variety of strategies to help establish better working relationships between the dialysis facilities and their transplant centers by using liaisons, coordinators, as well as patients themselves. We continue to use a variety of tools, some of which focused on education about the steps between referral and waitlisting, as well as tracking tools to better engage facilities in helping patients on this pathway. We shared best practices among providers. And despite this effort, we unfortunately did not meet our goal. Here again, you can see the distribution of networks across the country as a relative percentage of meeting their transplant goal. And although Network 11 is on the right-hand side in the yellow bar, you'll notice that none of the facilities across the country met their transplant goal this year. Turning to our vocational rehab project, there were two parts. The first was to increase the percentage of patients referred to an employment network or vocational rehab service by at least 10%. By September, we were over 40% and so met that goal. The more challenging part was to increase the percent of patients actually receiving employment network or vocational rehab services to over 5%. And we were able to just meet that goal by the end of the project period. And here you can see our progress over time. We typically haven't reported much in the way of vocational rehab referrals or services, so our baseline period was listed as 0. But with the efforts of you all and our project, we were able to increase that quite significantly over the year period. Again, here's where Network 11 stands in the yellow bar relative to the other networks in the country that participated in this project. And lastly, a graph of the patients who are actually receiving vocational rehab services over the course of the project. And again, sustained improvement over that period. And lastly, where Network 11 falls relative to other networks in terms of patients actually receiving vocational rehab services. I'll finish up by discussing patient and family engagement. Throughout all of our projects, we've worked hard to incorporate patients and their families as part of the quality improvement efforts. In addition, we work with facilities to help promote engaging our patients by participation in their plan of care, participating in the quality assessment and performance improvement process, as well as participating in support groups in their facilities. This slide shows the results of those efforts, and we now have over 50% of facilities having patient support groups available. Last year, that number was closer to a third. Currently, we have 98% of facilities that have their patients participate in their care plans. Again, last year, that number was only 80%. And now, almost 3/4 of our facilities have patients join the interdisciplinary team in monthly QAPI meetings. Again, last year, that number was closer to 50%. So, strong work all the way around in engaging our patients and families in this whole quality improvement process. Let's turn to looking at the current year, 2020. I'd like to point out that the CMS national goals that we discussed on last year's call have not changed, but to review briefly, these include a reduction in the national rate of bloodstream infections by 50% relative to the baseline period in 2016. With regard to transplant, the national goal is to have a 30% increase in the number of patients on the transplant wait list compared to the 2016 baseline average that was 18.5%. And lastly, there's a national goal to increase the number of dialysis patients who receive their therapy at home from the baseline of 12% up to a target of 16%. I'll review our quality improvement projects that we have slated for this year and highlight a few of the differences from last year. We'll continue our efforts to reduce bloodstream infections by recruiting over 100 facilities that have some of the highest bloodstream infection rates in the network. The goal is to once again reduce bloodstream infection rates by 20%, and that would take the cohort from 1.4 per 100 patient months down to 1.2 per 100 patient months, which is still higher than the network average on the whole. We'll continue our work on reducing long-term catheter rates, but this year, all facilities in the network will participate, rather than just a cohort of facilities like we've done in the past. The goal is a 0.25% reduction, which would lower the rate across the network down to about 12.5%. In addition, we'll help 10% of network facilities join a health information exchange to better track bloodstream infections. Here is recent data for the percentage of patients on the transplant wait list indicated by network. The national average, shown in the orange bar, is just above 16%, and you can see Network 11 is just to the left of that bar at just under 17%. So overall, we do relatively well in getting patients waitlisted for transplant. Our transplant waitlist project will continue on in 2020, and our goal is to increase the number of patients added to the kidney transplant waitlist by 1.25%. At our recent Network 11 annual meeting for our medical review committee and board of directors, we spent time brainstorming to identify barriers to transplant and then potential solutions to increase the number of patients added to the waitlist. We're excited to try new ideas and want to hear about best practices that you all have identified in helping patients with the waitlisting process. Here you can see trends in home dialysis rates across the Midwest Kidney Network. With regards to home dialysis, we've had modest growth over the past 9 years in the proportion of patients who do their treatments in the home setting. And again, here's a distribution of home dialysis therapy at the national level broken out by network. Again, the national average at 12.6% is shown in orange, and to the left of that is Network 11 at about 12.7%. Our home dialysis project this year will be to increase the percentage of patients who start home modality training by 2.5%. This project will involve all facilities in the network. Our baseline of 5.2 from last year will be to increase the goal up to closer to 5.6 by the end of this year. And lastly, I'll finish up with our vocational rehabilitation project. We'll continue that work that we started in 2019, and we're recruiting 50 dialysis facilities with 4 goals for the project. The first is to increase the percent of patients referred to an employment network or vocational rehab service by 50%. We'll try and increase the percent of patients receiving employment network or vocational rehab services by 1%. And we'll screen at least 95% of patients for interest in vocational rehab. And lastly, the goal will be to refer at least 10 patients between the ages of 55 and 64 to employment network or vocational rehab services. So in summary, we've had an incredibly successful year in 2019, and we were one of only 4 networks in the country that met 8 of the 9 quality improvement goals. So overall, I think we had a successful year. Our quality improvement activities will obviously continue on into 2020. And on behalf of all of the network staff, I'd like to thank you for the help and care that you provide our patients as they travel on their journey with kidney disease. Thank you.